Hello and welcome. If you or someone you care about has knee osteoarthritis, you've probably heard a lot of different things about it, and some of it might have sounded pretty concerning. Well, today we're going to cut through all that noise and explain what's really happening inside the knee joint, based on the most up-to-date science. If you've watched the videos on low back pain, this explanation will feel familiar. Today, we're applying the same evidence-based approach to knee osteoarthritis. For a long time, the story we were told about osteoarthritis was filled with really unhelpful terms like wear and tear. But the way we understand it now has changed a lot. We're moving away from that old simplistic narrative to a much more accurate and, frankly, much more hopeful one that's all about the health of the entire joint. So let's start right there. We're going to completely reframe what osteoarthritis actually is. The goal here is to really move past those old, outdated ideas. And this is a really powerful statement from the research community. Experts are now very clear that phrases like wear and tear or bone on bone aren't just wrong, they can actually be harmful. They paint a picture of a joint that's fragile and just falling apart, which is simply not what the science tells us. So, if it's not wear and tear, then what is it? Well, the modern view is that osteoarthritis is an active process. You see, your joint is a living system, and it's constantly trying to repair itself. OA happens when the things causing damage start to outpace the body's natural ability to repair. It's a dynamic imbalance, not just a one-way street of decay. And here's a really crucial point. This is not just a cartilage problem. When we talk about OA, we are talking about the entire joint system. That means the cartilage, sure, but also the bone underneath it, the muscles that support it, the ligaments that hold it together, and even the inner lining of the joint that produces lubricating fluid. They're all part of the story. Think of it like a set of scales. On one side, you have things that can cause stress or damage. On the other side, you have your body's incredible repair crew. In a healthy joint, those scales are pretty much balanced. With osteoarthritis, the scales have tipped a bit. But, and this is the key, that repair process is always at work. All right, let's move on to our second big point. And this is a big one because it's something that causes a lot of confusion and anxiety. The difference between what an X-ray might show and what a person actually feels. This brings us to a really fundamental question that puzzles a lot of people, maybe even you. Why is it that some people can have a scan that looks really severe, but they feel pretty good, while someone else has a mild-looking scan, but they're in a lot of pain? How does that work? Well, the answer, based on decades of research, is that scans are surprisingly bad at predicting pain. As you can see here, the connection is actually pretty weak. It's really common to find changes on an X-ray, especially as we get older, and very often it tells us very little about how you feel or function day to day. Your scan is not your destiny. So if the pain isn't just a direct signal from the structures we see on a scan, what else is influencing it? This is where our understanding has really blossomed. Pain is a complex experience. It's influenced by everything going on in our lives, not just a simple message from our tissues. I mean, think about it. Your mood, how you're sleeping, your stress levels, your muscle strength, even the support you have from friends and family. All of these things can act like volume dials for your pain. This is why two people with the exact same knee on an X-ray can have completely different experiences. Okay, so let's pull all this information together. What are the most important evidence-based messages that you should really take away from all of this? Let's just walk through these 5 essential facts because they really do paint a much more accurate and positive picture. First, OA is a condition of the whole joint, not just the cartilage. Second, your X-ray does not decide your fate. Third, this is not an inevitable part of aging. Fourth, symptoms don't always get worse. They can go up and down, and they can absolutely improve. And fifth, and this is so important, the vast majority of people with OA manage it really well and never need surgery. So the bottom line is this: we really need to start seeing osteoarthritis for what it is, a manageable, long-term condition. It is not a life sentence of inevitable decline. Just like any other long-term condition, there are so many positive, effective things you can do to live well with it. So we'll leave you with this question to think about. After hearing this modern, evidence-based perspective, how does it change the way you think about knee osteoarthritis? Thanks so much for joining us.